Hej, ni är mycket välkomna till lördagens sändningar från Bokmässans globala torg. Det globala torget är civilsamhällesorganisationerna inom biståndet som ställer ut tillsammans. Vanligtvis i Göteborg där vi träffar jättemycket trevliga människor. I år finns vi på webben. Allting livesänds, allting kommer ligga kvar också och man kan kommentera och komma i kontakt med de som är här och talar på det sättet. Hoppas att det kommer att funka bra. Dagens tema är 2. Vi kommer att prata om jämställdhet hela dagen och vi kommer att prata väldigt mycket om Sydafrika i vår egen Sydafrika-satsning. Och i nästa seminarium så kopplar vi ihop de här 2 delarna. Och det här är då inte arrangerat av det sydafrikanska turistkontoret utan titeln på det här seminariet är Ett krig mot kvinnor, könsbaserat våld och könsbaserade mord i Sydafrika. Arrangör är ACT Svenska kyrkan och samtalsledare Maria Bard.
Welcome to this session organized by ACT Church of Sweden at the Global Square at Gothenburg's Book Fair. The title of the session is A War on Women, Gender-Based Violence and Femicide in South Africa. On the 4th of June, 28-year-old Segofatso Pule left her home to buy clothes for the child that she carried. It was her first child and she was excited, of course. However, she was found the next day, hung in a tree, stabbed to death. That day, Segofatso Pule became 1 out of 8 women killed every day in South Africa. President Cyril Ramaphosa has referred to the situation when it comes to gender-based violence and femicide as a war on women. And to this already acute situation, the COVID pandemic has of course made the situation even more difficult. However, gender-based violence is not something that's new in South Africa. It's been something women's movement and activists and organizations have been combating for years. So the knowledge is there, the policy, the legislation, and funding to a certain extent. Yet South Africa is still having some of the highest level of gender-based violence in the world. But why is
viktig?
Today's panel talk, we would like to discuss this issue. Why do we have the situation we have today in South Africa? What role does norms and attitude in society have to enabling this form of violence? Why is the need for access to sexual and reproductive health and health services important for society? And the entry point for our discussion, it is of course South Africa. But as we all know, this is not a place limited to one country or one continent, but it's actually something that's worldwide. We know that in Sweden and we know it everywhere. So we also want to take the discussion to the next level and discuss the global backlash that we see when it comes to SRHR and women's rights and bodily autonomy globally. And all of this will be discussed by this distinguished panel that you all guys will see in front of you here right now. We have Nompile Kakwese with us, who is leading the Survivors Network Pepisa. She is herself a survivor of gender-based violence and active in these issues in the women's movement in South Africa. We have Dr. Tlaleng Mofokeng, who will be referred to as Dr. T further on in the discussion, who is a medical doctor, a human rights activist, and recently the UN Special Rapporteur on the right to health. And we have with us also Professor Charlene van der Veld, who's the head of the Department of Gender and Religion at the University of KwaZulu-Natal. And my name, who will moderate this talk, is Maria Bard. I work for ACT Church of Sweden as the regional representative to Southern Africa. But let me take us back to where I started. Segofatso Pule. She is the reason that we are here today and that we are joining together and discussing all these important matters. But too often, stories like Segofatso Pule's is not heard. it's forgotten or it's hidden away. Act Ubumbano, it's a network in South Africa containing of faith actors, the civil society organizations, a partner to ACT Church of Sweden, and through their voice app, young women have been able to share their stories at a safe place. Because telling your own story, it's an act of empowerment. And for many, it's an important part of their healing. Now, Pilo, I will start the discussion with you. You were part of working with this Young Women's Voices initiative. Why was this important for you to be part of?
Thank you very much for that opportunity. What is important is having to voice out, more especially as survivors of gender-based violence, where we did not have platforms to tell our stories and hear each other's stories. So for me, this has been a great experience and a platform where I can openly share, given that the consequences we suffer after trauma and after the violation, where we don't have other resources or other platform where we can tell our stories and find that comforting but empowering ways of expressing ourselves and learning from other survivors. So for me, having that opportunity to listen to other survivors, but simultaneously telling my story, I think that gave me strength as a survivor to go out there and reach out for even more personal support.
And what do you hope that the Young Women's Voices initiative will have for others?
I believe that the more that it reaches out to other communities, to other rural communities, it will then give survivors, women, a platform where they can have that safe space to each other, create that safer environment to each other, to have that moment to each other, to empower and advocate amongst each other, knowing that there's power in voicing out, and then we create that space so that we don't keep recurring and re-victimizing ourselves because of not speaking out.
Yeah, because that's when we spoke before this talk, you said that you yourself had suffered the consequences of silence because you had waited yourself before seeking help. What did that mean?
I suffered for many years because I did not, I never related to other survivors. I never knew other survivors of sexual gender-based violence. So to me, this was just my story, and I suffered in self-confidence. I suffered, and why me? That why me that comes as a consequence of being violated. So now reaching out, hearing other stories, then heals a lot, and then you discover that it's not just part of statistics, but actually there are women like you out there now. Meeting them in personally, seeing personal stories, then move your perspective and your mind of not being just a statistics, but a voice to other women.
Thank you for sharing that. And you're yourself leading a survivors network called Pepisa. What does that, what do you want to achieve with this network? Why do you think it's important to have a network as such?
I believe we have so much services for survivors in South Africa that support women, but I saw the blind spot of not having so much survivors groups where we can do healing sessions and have to carry each other emotionally even after these sessions, because these recurring consequences I've been telling. So we're just creating that platform that there is no time frame of healing. So we have that continuous healing to each other, and trying to bring even awareness to other women of knowing these services and being a safe space, and create these small environments, even in our small groups, even in our smaller communities.
And today the government of South Africa have taken several steps to address the issue of gender-based violence today. But what do you think the government should do even more, according to your experience?
What I like, it's the inclusive of civil society organization, those small community-based organization. But I think the emphasis should be more now, even in creating spaces or having awarenesses, or the more focus on the change of attitude. How do we then concentrate more in perpetrators than having these more survivors? How do we then? So I think the more thing that should be done now is to see where are the blind spots, because of all these platforms survivors have been having, but we still see cases rising. We see GBV is now dominating. So what are we missing? And then that might be the mind change. How do we move from this patriarchal issues that we have even more in rural areas, where men are groomed in a certain way that is not so comfortable for women? So I think the focus now should be more on attitudes and patriarchal system that we live in.
Thank you so much, Nompilo. Let me continue. Thank you, Nompilo. Dr. T, we've been listening also to I mean, the situation in South Africa, it's so horrific and extremely frustrating. When we spoke prior to this meeting, I felt a lot of, we spoke about anger, and I could feel you were angry. Can you tell me something about that? Because this is what I'm sensing from many people in South Africa. There's a lot of frustration and even anger about the situation.
Yes, I think anger is what I would use to describe, and also a feeling of helplessness, a feeling of not being able to thrive, and just really the impact of violence, you know, living under a constant threat of violence, or surviving violence, or experiencing violence is such an isolating moment. And for many of us in this country, we've been enduring years and years and years of violence, and often feeling unheard. And I think it's that feeling of not being heard and not being seen, and not being validated in that anger, as if, you know, women and people in civil society are overreacting. Yet we know the impact of violence is often, for many people, a long-term problem that has immediate and quantifiable negative health outcomes, mental health well-being, of course, as well as physical well-being. So the anger is from many, many moments and many, many times of advocacy and ways that have failed, and women feel that the government has failed in responding and in creating a country that's safe for everyone that live in it, especially women and children.
But how is that even possible? I mean, you are one of those champions who have been fighting for so many years, and listening to all of these human rights activists and scholars in South Africa, and even listening to the president giving speeches about this, prioritizing, setting this is a war on women even. How is it even possible that you're still in this situation right now? What's your analysis of that?
So one of the main problems with South Africa is that we struggle as a country, and those in governance, to translate our constitution and our policies, which are rightfully based on human rights, right? They use a human rights framework, but there's no translation of those documents and those policies and that constitution into services. There isn't a translation. As much as the constitution gave us all these rights to the freedom of violence and a life that's free of violence, when we are living every day in our homes, navigating public spaces, public transportation, when you are at work, when you are at churches, when you are shopping, there isn't a space where we are safe. And therefore the frustration is that we have all of these rights that are affirmed in the constitution, yet in reality our experience is not one or that promotes and then protects those rights. And I think the problem really, again, which is really a fundamental problem, is that there hasn't been a resourcing, a financial resourcing, and a plan that looks at how to sustain the resources that are required to have a comprehensive response. So if you look at prevention strategies, there isn't still an understanding and a quantification of how much money is required annually to actually make sure that we implement prevention strategies at all levels of governance and of society. There isn't a full understanding and a resourcing of immediate victim-centered support for those who survive violence. And there's continuous delays in terms of accessing the courts and accessing justice for those cases which have become a criminal justice system issue. So there's a continuous feeling of we are just being let down by the system, by lack of implementation, by lack of resourcing that will tell us that there's political will to fix the problem. And I think that's another problem, is that there's a lack of political will that is demonstrated that will make us as civil society feel safer and feel heard.
How can you actually change that? How can you, what is needed to change that, would you say?
So I'm placed at a national human rights institution, the Commission for Gender Equality, and it's a constitutional body that was mandated to promote and protect and advance gender equality in South Africa. And the vision is to have a society that's free of oppression based on gender and sexuality. And one of the roles that we have is to play oversight and monitor all public and private, as well as civil society institutions. And one of the roles that we have been playing as the Commission for Gender Equality is being present when that National Strategic Plan for Gender-Based Violence and Femicide was being drawn up. We were part of that process, and we continue to be engaged in terms of the different government institutions, from the Department of Women and Youth and People with Disability to Department of Justice and Correctional Services, Department of Social Development, Department of Health, the National Prosecuting Authority, to ensure that in all the solutions, in all the plans that they have, including the important Ministry of Police, there is a gender lens to it, that we don't truly leave anyone behind, and we are really inclusive in terms of thinking about people who have disabilities, thinking about the LGBTIQA+ community, which continue to experience homophobic rape when you are talking about Black lesbian women in South Africa. So our role is, one, to monitor, but secondly, make legislative suggestions, as well as give advice, especially when it comes to this council that will overlook the implementation of the National Strategic Plan for Gender-Based Violence and Femicide.
And going back to your experience of being a medical doctor yourself, you have also met a lot of women who've been exposed to violence, been raped, and different forms of violence. What role would you say that accessing SRHR services have to actually be able to continue that healing process?
We continue to have an unmet need for services. So if you are a survivor of any form of physical or sexual violence, you don't know what you are going to find at your nearest public health facility, whether it be a clinic, a community center, or a hospital. There is a lack of information just about what services constitute a service for survivors of rape or sexual or physical violence. There are a lot of delays to accessing services, even if you present yourself as a survivor to a healthcare facility. We do not have adequately trained forensic medical staff, as well as social workers and psychologists who are forensically trained, and therefore there isn't a seamless referral between the allied medical health support services as well as the clinicians and the doctors and the nurses, which means that there are delays in terms of care. So if someone presents to a clinic, it may take them a month before they have any contact with a psychologist. And that raises a question about immediate emotional support and debriefing and containment. It raises questions about the evidence that's required to be collected for the DNA evidence kits. We know the more time is prolonged and elapses after the violation, the harder it is to have good quality evidence. So there is also a lack of coordinated response between the hospitals and the healthcare system and the policing, which have to then bring the evidence kits that are going to be collected, which means then the quality of the evidence that's presented to the court when the time comes for this case to be presented in court is very poor. And this is one of the reasons that leads to poor prosecution, statistics, which again says to women, this issue is not being taken seriously. If they report, they present to healthcare facilities, there's gross delays and undignified care, and what ends up happening in the court is also a testament to say no one takes this issue seriously, because even if we report and do all the right steps, the rapists and the perpetrators still walk away scot-free.
But the government has taken several steps, taken several initiatives to address the situation. Would you say that what you're talking about now, is that prioritized? Or is it something that needs to be further pushed into that agenda that's being formed right now?
So one thing about South Africa that, you know, we always have to remember, and I'm not sure that our leadership and the people in governance take seriously this issue. South Africa has a history of colonialism and apartheid, right? Which still has impact in terms of spatial planning in this country. So your geographical location in South Africa still determines what you have access to and what you don't have access to. If you are in the urban centers, you are still more likely to access services than someone in the peri-urban and rural areas. So if we are coming up with plans, we have to think beyond just talking about what needs to be done. We have to go into the nitty-gritties of understanding what access looks like to people. You can build 100 clinics and build them in urban and peri-urban areas, but the rural community, which is still the majority in this country, will still not be able to access services. So services have to be where people are. Services must come to people. People can get to services, and COVID-19 is a good example to illustrate what we mean. We've always known that violence disproportionately affects people in the rural areas. It affects women, it affects LGBTIQA+ people. But with COVID-19, with the lockdown regulations, it meant even those communities that heavily rely on public transportation to get to work and to get their essential services, including healthcare, could not get there because there were curfews, public transportation was not operating in some areas, and therefore the militarization as a response to COVID-19 did not help at all. When women already don't feel safe in their own homes, now during COVID-19, women will not feel safe to now go and go outside of a curfew, risk being abused by the military or the police themselves because they have broken a curfew while they are running away from a violent situation within the home or the community. So there needs to be a much broader thinking and a deepened and a nuanced understanding of the issues that impact the different communities. And unfortunately for us in South Africa, spatial planning and geographical location of services is still very much an important factor that will lead to either increased services or unfortunately continuing to leave many communities in the margins.
Because this is also what Nopile said initially. Nopile, you said as well that there is a need to understand that in rural areas, the patriarchal norms are much, much heavier than they will be in urban areas. And you were also talking about the challenges of living in the urban context here, Dr. T. But do you think that norms and attitudes do also impact then accessing these services?
I think it's important because norms and attitudes often drive prejudice and discrimination. And there is a culture where, and globally everyone refers it as rape culture, right? That we are all living in societies and countries and communities that actually enable violence to keep happening. And it shames the people who are survivors. Even the language that we use, right? We always center the person who violence happened on. We know the victims, and it's the women's faces who are in the newspapers and that are being referred to in radio bulletins. But you don't see the faces of the perpetrators because they are protected by the law because there's allegations against them. So even how we cover stories, there's a way that we cover them that puts shame on the person who has survived. So when you have been raped, when you survive violence, some of the internal dialogue that you are having with yourself is firstly, will they believe me? Because rape culture has made it and normalized the fact that we expect women and children and the LGBTIQA+ community to only walk around in the daytime and modify their clothing so that they can then not be raped, which is wrong. It's completely false. We all have a right to occupy public spaces and walk and be where we need to be, wherever we need to be, and get dressed and do whatever we need to do. But rape culture says, why were you walking there? Why did you go to that party? Why were you in that office building alone? And yet women are working late, long hours after work. Who must come and sit with her in her office while she's working late and trying to reach her targets and her deadlines? So rape culture enables violence. Rape culture, again, says that perpetrators have no social consequences, right? And in many of us, in all of our countries, whether it's the global south, global north, developed countries, men continue to get away from consequences, but also they get elevated to positions of leadership, knowing that they are perpetrators with a history of violations and violence and sexual and physical violence, and yet they end up being elevated to positions of leadership, which means there's absolutely no consequences for violence as a society. There is just absolutely no social consequences for being a rapist or a perpetrator.
You actually said when we spoke also before that maybe the women of South Africa should sue the government for not doing their job.
So you have to think about accountability, right? And recourse and justice. And what does justice look like for survivors? And I have a medical doctor who's treated toddlers who've been rape survivors, all the way to grannies and people in their 80s, right? And justice looks very different to all of those people. But ultimately, it's about accountability. And unfortunately, we've seen it previously with the civil case, right, around access to antiretroviral treatment to prevent mother-to-child transmission. That problem was escalating. It became a health emerging problem in South Africa that was not properly responded to by government and leadership, up to a point where it escalated, where civil society had to intervene to force the hand of government. But the only way civil society can hold the government accountable, unfortunately, is through a court process. And so it shouldn't get there. But what else must women do in South Africa? What else must they do? What else are they left with? Because we have marched, we have filled the streets, we have shut down the country, we've marched to institutions of business and financial institutions and corporates. We continue to put our bodies on the line day after day in institutions of higher learning, and there is just no response. And so the question is, what then needs to happen? And that is possibly the only avenue that hasn't been explored by women, because going to court costs money. And again, we're talking about a patriarchal society, a patriarchal country that where rape culture is normalized. And so for women to do that, it will take, unfortunately, quite a strategic effort. But that's, for me, it's the only thing that women haven't done. They've done everything. We speak, we keep talking, we do interviews, we march, we do everything. And perhaps I think for me, it's the only avenue left.
Thank you. I will continue. We should continue with Charlene. So both Nompilo and Dr. T have spoken about the importance of addressing, or the challenge of living with patriarchy, and the importance of addressing norms and attitudes. As a professor working with gender and religion, working with these issues on a daily basis, norms and attitudes, what do you think? What's your comment on that?
Yeah, I mean, it's really interesting to talk about Dr. T's remark about the disconnect, you know, between our constitutional dispensation and then the lived realities and the access to services by people affected by gender-based violence. And I think every time that, and I think my students roll their eyes now, every time that I start my thinking around gender-based violence, always refer to the work of Professor Rachel Jukes at the Medical Research Council in Pretoria. She did a massive study in the South African society asking about the causality of gender-based violence. So asking why, if we are doing all these things and if we're trying to make an impact, what ideologically underlies the rape culture and the culture of gender-based violence in South Africa? And she alludes to two really important ideological hooks at the bottom of her construction. So she says it's not one thing that causes it, right? It's a constellation of factors, and these factors are complexly linked to each other. But she says ideologically, gender-based violence is informed by two main issues. The first is the ideology of male superiority. And then secondly, a culture of violence. So in default situations of conflict, South African responses is violence. And this, as Dr. T has also mentioned, is deeply informed by our history of colonization, apartheid, dehumanization that people have suffered. But I think patriarchy, and it's interesting how very seldom people want to really go down into the heart of it, which is patriarchy, and really want to sit with the complexity of that and to think about how this systemically informs our society. An ideology that constantly affirms the fact that men have more value than women. If you live in a society where that is constantly reiterated, it's no surprise that our landscape looks the way it does. And I think, and it's really interesting to listen to the discussion, if you think about the two places where that ideology is bolstered in the most profound way in the South African context, is probably within landscapes of traditional culture, where male superiority is sort of lauded over, and people structure systems and families and societies around that notion. But the second place, and this is where the work I do sort of links into the conversation, is to say on a Sunday morning at 9 o'clock, faith communities across the South African landscape meet and we read sacred scriptures, and we gather in institutions and in society where we also keep on telling communities of people that men are superior to women, that if we read the Bible, God says men are somehow more human beings than women. If we continue to perpetuate faith discourse that uncritically engage with patriarchy, nothing will change. Because on a Sunday morning, that is reinforced, children grow up in that. And to come back to Nompilo's point, where's norms and values formed? Yes, in the family, but considering the South African family landscape and how often, kids come from broken homes or single-headed households, how often our responsibility around the creation of norms and values farmed out to faith communities. So then you send your children to faith communities where it's reinforced that men are superior to women. If that is the case, if that's what we continue saying, then people can make nice promises and bring out strategic plans and say all the right things on the news. Even our president can say that. But if we're not willing to interrogate patriarchy as a value and as a governing ideology of our society, we're never going to move in the right direction.
And how can faith actors, or what you're talking then about, how can you work with them? How can you, how do you work actually?
Okay, Maria, I think that's a really important question, and often something that people within civil society or even NGO landscape, when people think about faith actors, they usually roll their eyes and think, okay, I'm not even going to engage faith actors because we exactly know what they're going to say. They are part of the problem. And of course, I understand that positionality, and I understand that also exhaustion with that patriarchal discourse and that way of navigating this landscape. But I think ignoring faith actors and sort of bracketing them all as they're problematic, they're part of the problem, they're not going to make any difference, really undercuts the role that the church could potentially play as a first responder to the survivors of gender-based violence, as Nompilo has also argued, as places of healing, as safe spaces. If the church lives up to what she could be, we could create spaces where people could find safety and where people's value could be affirmed. But for that, I mean, and I think that's what I do for a living, is to try to sit with faith leaders and people who are already functioning as leaders within faith communities, and to try to conscientize faith leaders and to develop vocabulary with faith leaders to speak about these these issues, to help them with systematic analysis tools, to say how do you engage the gospel in a way that doesn't reinforce patriarchy. So I think my approach has been to say, if we cultivate in faith leaders change agents, so people who speak in a new way, people who act in a new way, you've got the potential to bridge that gap between high-level policy making and the demands within communities. Faith communities function at that exact space between those things. So if they do their job, they could be an immensely powerful tool in addressing gender-based violence.
Thank you, Charlene. Thank you so much. Thank you all for sharing your knowledge and experience. These conversations have been very, very rich, and I think there have been lots for all of us to think about. Some of the things that I will take away from this discussion is the challenges of living in a patriarchal society where rape culture is normalized and where other forms of violence follow on that. The importance of placing survivors at the center of all approaches to address gender-based violence. And also the importance of addressing destructive norms and attitudes in society to be able to identify the root causes. And how faith actors can be part of a positive change if you provide the right support. I would also like to encourage the audience to, who all of you have listened to learn a bit more about a survivor-centered approach and really advocate for new innovative partnership with FBOs, for example, such as Charlene spoke about. The late Ruth Bader Ginsburg of the US Supreme Court, who dedicated her life to fight for gender equality, she once said, "Real change, enduring change, happens one step at a time." Let us hope that this moment that we've spent together has inspired us to stretch a bit further, to be part of reaching and realizing enduring change and access to human rights for all. Thank you.